I've done a video previously on the preparation and thoughts around getting my tummy tuck or abdominoplasty. Now I want to talk about the chest reduction procedure I had, or also known as gynecomastia procedure. A lot of the planning and preparation is very similar to getting an abdominoplasty, and a lot of the things I did cover in that other video, which I've linked in the description. Some of the main key points: don't go deal hunting, just find the surgeon or the clinic or the setup within your budget that you feel safest with and that you feel most confident in. Be realistic about results. So don't expect 100% perfection. Don't expect perfect symmetry. You will have scars. And of course, plan ahead for your recovery. It's going to be quite disruptive to your day-to-day life. You're not going to be able to drive. You're probably not going to be able to move properly for a while. So yeah, there's a few things that you need to think about. So what is a gynecomastia procedure? It's also known as male chest reduction. In some minor cases, what happens is that the surgeon will create an incision in the chest, lift up the nipple, pull out the excess tissue, and sew it back in. In more extensive cases like mine was, it's a case of creating an incision, removing the excess skin, and then stitching that back up. As you can see in my case, the scars are still healing. I'm recording this in August, so it's been about 5 months. So you can see I have the scars along, like just under my chest and coming up the side here. When my chest is relaxed, they kind of fit in under the groove of my chest muscle. I also want to just mention before going too far that nothing I say in my videos should be seen as medical advice. I'm not a doctor, I'm not a surgeon, I'm not a qualified health practitioner in any way, shape, or form. Please speak to someone in person. They'll be able to give you specific advice that's relevant to you and your situation, and definitely trust them over anything I say. All I can do is provide my own experience as a patient, as someone that's gone through this, and to an extent still going through this because I'm still in the recovery process to some extent. There are some specific things you want to think about with a gynecomastia procedure. If you have a minor procedure around the nipple, then any scarring might not be noticeable at all. If you have a more extensive procedure like I did, then you will be left with scars. If it's a more extensive procedure, you'll kind of have to weigh up for yourself if you're happier with the scars and the overall contour, or whether you prefer to not have scars and just keep the body shape that you got. In my own case, just because of how much extra tissue I had, I was much happier to focus on my contour, and I figured if I have scars, I can eventually tattoo over them anyways if I really wanted to. Also, I'm pretty comfortable with my scars. I was never comfortable with my loose skin. I was never comfortable with my extra tissue, but the scarring, I'm okay with. As you can see, I'm standing in front of a camera and just, casually lifting up my t-shirt to show off these scars. I don't have the biggest or most defined or most muscular chest, but I have enough definition that the surgeon could put the scars directly under the chest muscle, which means that they'll stay well hidden. My chest is still a little bit swollen, but you can kind of see where the scar is. And once that swelling goes down and the scarring relaxes a little bit more, that'll kind of sit nicely in that groove. And it also means that if I do want to tattoo over it, it's kind of a nice clean line to tattoo over. Your surgeon will be able to talk to you about scar positioning and scar placement, and you need to think about if you'll be happy with scars and if you'll be happy with where they are. Not just scar placement, but also what the end scar looks like. Like, I've got Asian skin, but so far my scar has been healing pretty well. But Asian skin and darker skin does have a risk of, darker or lumpier scar formation just because we have more melanin. Next thing is look at your recovery. If you do have a more extensive procedure like I did, you do need to plan ahead for your recovery. At the date of recording, it's been just about 5 months, and it's only sort of in the last month or so that I can reach up overhead comfortably without feeling any tightness or restriction. Reaching overhead, it stopped feeling sore about 9-10 weeks, but there's still always been this kind of feeling of tightness, feeling of restriction, almost like something, just a little bit extra resistance as I try and reach. That only started to go away in the last month or so. Plus, for the first 3-4 weeks, I couldn't actually get my arms past shoulder height, so about there. So for 3-4 weeks, I was only wearing button-up tops or zip-up tops. And then when I started wearing t-shirts, they were very baggy, very stretchy, and that was about 3-4 weeks in, and that was just so they were easier to get off and on. You also won't be able to drive properly until it's pain-free, and the guidance I was given was that you won't be able to drive until you can safely and comfortably do an emergency stop. You won't be bedbound at any point, but you may feel a bit apprehensive about just moving around, reaching your arms out. You lose a bit of confidence and you know that you're feeling something move every time you try and move your arms. You won't be able to shower properly for a few weeks. When I had my procedure, basically no shower at all for 48 to 72 hours. I had a follow-up at 48 hours and then I was given the go-ahead to start showering. And that was back to shower, try and keep the wounds as dry as possible, try and keep the tapes covering the wounds as dry as possible. So what I had to do was low power, back to the shower head, so just like showering my back, and then sponge bath or antibacterial wipes for getting around the wounds to keep myself clean, because I'm a little bit of a clean freak. You'll also need to wear a support garment for 6 to 8 weeks, and that's quite a tight-fitting elastic one. And that's, again, just to help the wound settle and to keep things in place. I got the all clear to stop wearing that at around 6 weeks, but I kind of got so used to it, I just felt uncomfortable not wearing it for a couple of weeks. So I only stopped wearing it after around 8 weeks. And because you do have these fresh incisions on the front of your torso, you're going to need to sleep on your back. And as someone who's slept on his stomach for pretty much his whole life, that took a lot of getting used to. In terms of preparing for your procedure, there's no specific diet or anything that you need to follow. You will, however, want to stay at roughly the same shape and body fat percentage for a little while. I think the guidance I read was about 6 months. For me, I'd been at around the same weight range for a couple of years. So it's fine. In my case, the shape of my chest muscles and the definition I had seemed to have worked in my favor because it provided a nice groove for where the scars could fit in. Mentally, any surgery can give you thoughts of anxiety and fear and nerves, and that's completely normal. And of course, with any major procedure, there are always risks associated with it. Something like this is never cheap, and you kind of need to decide for yourself if it's going to have enough of a positive impact on your life to make it worthwhile. And if you're happy with the risk associated with it, if you're happy with the recovery process, if you're happy with the scarring it may leave, you have to weigh all that up for yourself and really make your own decision. For me, I am still healing. I'm still in that recovery process. It's been 5 months and, it's not stopping me or restricting me in any way, but, it is still swollen. So I'm still kind of having to massage and just focus on that scar care. But my confidence has been a lot better. I'm very happy I got it done. Also, just in case anyone does ask, that plaster there is purely because I had a spot there that I ended up scratching. It's nothing to do with the surgery itself. If you have any questions, leave me a comment. If you found this useful, please remember to subscribe.